The main purpose of this study was to evaluate safety and efficacy of combining velaparib to chemotherapy, either with carboplatin and paclitaxel or temodar. We have presented the first two-arm comparison, and temodar plus velaparib data will be presented separate as a poster on Friday. Essentially, in terms of the basis of the study, PARP is one of the enzymes responsible for DNA repair damage. Velaparib is older potent PARP inhibitor. So tumors with BRCA1, 2 mutations have decreased ability to repair DNA, and therefore very particularly sensitive to PARP inhibitor and platinum-containing chemotherapy. So that essentially was the basis of this study. So patient population was with metastatic breast cancer or locally recurrent with germline BRCA1, 2 mutation. In terms of the result, the addition of velaparib to carboplatin and paclitaxel did not result in meaningful increase in terms of side effects. So that was very encouraging. In terms of efficacy standpoint, the primary endpoint of this study was progression-free survival, and the secondary endpoints included overall survival, clinical benefit rate, and response rate. Interestingly, in terms of the response, both arms did really well with very higher overall response rate, but patients on velaparib plus carboplatin and paclitaxel did better with statistically higher overall response rate with almost 80%, which was very encouraging. In terms of a primary endpoint, that we did observe a trend toward improved progression-free survival and overall survival, but it was not statistically significant. But again, I want to remind you that this was phase 2 randomized study with limited sample size, power to detect very large difference between the comparisons. And obviously the reason why we do phase 2 randomized trial is to see early signals to see whether this would warrant further investigations in large randomized phase 3 trial without subjecting large patient on phase 3 trial. So the data that we have definitely support ongoing efforts of phase 3 trial and warrant further investigation of phase 3 clinical trial. And we are hoping to get more definitive answers in phase 3 trial because it's power to see differences better for comparisons. Yes, phase 3 clinical trial called BRCA3 is currently ongoing, accruing patient very well, comparing patient with velaparib plus carboplatin and weekly paclitaxel versus placebo plus carboplatin and weekly paclitaxel. It's run on many countries, over 200 sites internationally, including many sites US. So definitely you can get information from clinicaltrials.gov, or if you even search for BRCA3, you will find a dedicated website to direct physicians and patients to find the closest center to be able to participate.